77 WABC.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
1991, my father, who you know I adored, we just lost him a year and a half ago, we brought him to Dr. Lederman. You need to bring yourself or someone you know who needs to have the barnacles scraped off their backside to get their rear in gear and walk in there right now because Dr. Gil Lederman is New York's only triple board certified Harvard-trained radiation oncologist, first brought the non-invasive stereotactic body radiosurgery to America, and he's got the longest experience treating cancer using radiosurgery. So look, do yourself a favor. If it's cancer-related, and I'm talking breast, lung, pancreas, liver, kidney cancers, and more, you got to bring it to Dr. Gil Lederman. He'll send you an informative booklet DVD. You watch it first, you read, you sit down one-on-one with Doc Lederman, and then you prepare for what it is you want to do and you should be doing. Just call Dr. Gil Lederman at 212-CHOICES. Set up that appointment today, 212-CHOICES, or set it up for someone you know won't do it for themselves. At 212-CHOICES, that's 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, M.D., New York's only Harvard-trained, triple-board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. We hope you're fine and having a great weekend and heading towards the end of summer. So this is one of the last weekends of the month. We have lots to talk about today. We're live, so if you want to call and ask questions, you're welcome to do so. We're in the WABC studios. We have Bruce here, who is fantastic. All the responsibilities of the studio are on his shoulders, and he is a perfectionist. So if you have questions, just call him, and he'll put the call right through. The number is 1-800-848-9222. Again, 1-800-848-9222. This is Dr. Lederman. If you haven't been with our show before, we were talking about how to have better health care, how to learn from other patients. It's almost like medical grand rounds where we discuss cases and dissect cases and we learn from cases so that hopefully the same difficult things don't happen to you. We hope the same good things happen to you, and we have a special section of the show called Good News, and we'll be talking about a lot of good news today because there was a lot of good news this week. So we're happy to bring you the good news as well as the news, and we can learn from everything. So again, this is Dr. Lederman. We work at a place called Radiosurgery New York, which is a cancer treatment center. It's a private cancer treatment center. We take, of course, Medicare, Medicaid, and insurances, but private means we work for you. We do not take money from the drug companies or from surgeons. No, we report to you. And that's how it should be. The doctor should serve the patient. Some people say, wow, I've never heard of that before, but that's how it is. At our place, Radiosurgery New York Cancer Treatment Center, the patient is the president of the United States, of their body, and we're just the advisors. We dissect the case, come up with possibilities, options, and you get to choose the options. I think that's how it should be. The patient and their family, their loved ones, should be in charge of that decision. So it's a philosophy, and we carry it out, and you'll hear from our cases. That's what we really, really do. And the first patient I want to talk about, the perfect example, is a man about 65 years old, came into a hospital in the 5 boroughs with anemia, and then he transferred his care after he was found to have esophageal cancer and a bone marrow disorder. And he went to one of the big hospitals, and he stayed there a couple weeks. And he and his wife were there, and after they left there, they were very disappointed that they weren't offered treatment for his cancer. In fact, it wasn't even staged up. It was almost as if it didn't exist. He got involved with a group of other doctors who only wanted to talk about the bone marrow, and no one wanted to talk about the esophageal cancer. So he came to us. I went through all the paperwork, and I said, well, no one's looked at the esophageal cancer. And the family said, oh, that's right, they were ignoring it. I said, well, don't you want to stage it up? Don't you want to see if it's localized or metastatic? How it would impact you, what the prognosis is? And the family and patient said, yeah, that sounds logical. And so we staged him up. And it didn't take weeks and weeks in a hospital, which you can imagine must cost tens of thousands of dollars, probably more. No, we got everything arranged in a day. We had what's called a PET-CT scan. Actually, we found 3 spots in the esophagus and a couple spots in the bone. So we found where it was and where it wasn't, and offered him all the options, from no treatment to treatment, all the things, chemo, etc. And he heard about our work, and his wife heard about his work. His wife is a energized woman. She has a lot of energy, and she wanted to get treated. So they came in just yesterday at lunchtime, and we treated the 3 spots in the esophagus simultaneously with radiosurgery. Now, radiosurgery is not surgery. There's no cutting and no bleeding. I know we have some listeners who say, don't say radiosurgery because it will frighten people off. But no, that's the name. The name comes from the 1950s when it was developed at first for the brain, and radiosurgery was used as a substitute for surgery. So the idea was, the name was saying we're using a radiation beam non-invasively from outside the body to substitute for surgery and the knife. So it's not, radiosurgery is not surgery, but it's a substitute for surgery, and that's where the name came from. So he had radiosurgery at about noon yesterday. He got off the table, was smiling. His wife was smiling because they saw that it's what was promised. That is, it's easy, takes about 15 minutes. You come in, get a treatment, and go to lunch. And they said, well, where's your go for lunch now? And if you can imagine having esophageal cancer treated and then wanting to have lunch, yeah, he wanted to have pastrami. And I sent him to my favorite place. I told him how to get it sliced and how to ask for it and get it lean, but not extra lean so it's not too dry. And he's going to get some chopped liver, and that's it. Radiosurgery for esophageal cancer, and 2 minutes later he's out getting pastrami sandwich in the best place in New York. So maybe he was at the 2 best places in New York. I'll say that about the pastrami. I won't say about us, but we sure do try. And with another patient who finished up treatment, also I would put in the good news category. It's a man about 50 years old who had decreased hearing. He was worked up. He has an acoustic neuroma. An acoustic neuroma is a benign tumor of the hearing nerve, the hearing and balance nerve, and he had symptoms. He got treated, 5 treatments. Again, each treatment's about 15 minutes. Radiosurgery, fractionated radiosurgery, which means we divide up the dose. Unlike Gamma knife, there's no screws in the head, so it's not painful, it's non-invasive, it's easy. Come in, get a treatment, and go home. I saw him this week. I said, well, how was it? He said, well, it was so easy. It was almost like you're pointing a flashlight at my head. I didn't feel a thing. And I said, well, that's how it's supposed to be. You're not supposed to feel a thing. It's supposed to be easy and safe. And he says, you know what? I also feel better. My symptoms are better. So it's the perfect case at this point. He didn't feel a thing. He said it was like flashing a flashlight at his head. He didn't feel a thing. And his symptoms are better. And he's taking off next week for a family vacation. He's going on a Disney cruise. So can you imagine having brain surgery, someone opening up your head and going on a cruise the next day? No. But with radiosurgery, one patient went for a pastrami sandwich, one patient's going on a Disney cruise, and that's what radiosurgery is about. It's so different than other treatments because it doesn't have the cutting and bleeding of surgery, it doesn't have the chemo and the injections and the blood counts and all the other stuff. In general, it's pretty easy treatment, and furthermore, it's highly effective treatment. How do we know that? Well, we follow almost every patient. Why isn't every patient? Well, some people don't want to be followed. Some people hear, for example, that acoustic neuroma success rate's 97% in our hands. And we have patients out at 20 years, and we've been doing this for more than 2 decades. So they're reassured, but we like to get follow-up whenever we can, and we encourage people to get follow-up. But again, you're the president of the United States of your body. You get to choose. We can only advise. You get to choose, and that's how it should be. Another man this week who has metastatic prostate cancer. He had 2 painful sites, and he was diagnosed when the cancer had traveled. And we treated those sites. The pain went away, and now he's coming in. He has back pain. I said, well, have you had this before? He said, I had it a long time, and it bothers me. I'd like to know if it's cancer, because if it's cancer, you can zap it with radiosurgery, like the other 2 places, make the pain go away. So we worked him up immediately. Actually, he told me at 9 o'clock, at 10 o'clock we had an MRI. At 11 o'clock he had the answer. No, there's no cancer in the spine. That is degenerative changes. It's from the aging process and disc disease. No cancer. And he said, I wish it was cancer. You could have treated it. So it gives you a different idea about cancer. When patients said, I wish it was cancer, you could have treated it and make the pain go away. But the 2 sites that were cancerous, we did treat non-invasively. Pain went away. The other site is just arthritis, aging process. And he'll take some aspirin or Advil or Aleve. And right now, the sites of active cancer are in remission. Thank God. Thank God. And we had another man who came in this week. Now, he just finished radiosurgery. He had massive disease, lymphoma in the neck. It was massive. You can imagine like 2 big man's fists of cancer, all in the neck, by the jawbone, the neck. He had a massive neck. And we gave him 1 treatment a week. We didn't want any side effects or his mouth to be sore because the cancer was so large and by his throat. So he came in once a week, 15 minutes, had treatment. The second week he came in, no one recognized him because the big mass had gone away. And by the 5th treatment, there was nothing left behind, really. And he had cancer in both right and left neck. And this week he came in, he liked the results so much on the left side that we are treating the right side. So we mapped that out this week, and he's going to start this coming week, and most likely he'll have the same results. So it was great for him. Fantastic shrinkage of the cancer, no side effects, doing well, so pleased he wants the other side treated, and that's the ultimate compliment, that you come back again, or you send your friends or loved ones for consideration of treatment. This is Dr. Lederman talking about health and patients and what to do. So we're going to hear from a few new voices here about work that we do at Radiosurgery New York, which is a cancer treatment center. We treat cancer in New York City. We're super conveniently located at 38th and Broadway. Why do I say super convenient? Well, we're next to Penn Station, Grand Central, Times Square, Herald Square, Port Authority, PATH trains, so it's so easy and accessible. Yeah, some people want to drive in, and that's great. There's parking lots nearby, but it's so accessible, and we aim to treat and take care of each person individually, and that makes such a huge difference. So we're going to hear from these voices, and I'll be right back. If you have questions, please call us. Thank you.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique.